Hi guys, it's Liz Parrish from BioViva, and today I'm here to share a very special video with you. This video was taken in 2015. I just recently bought the rights to the video so that we could share it with you. What is happening in this video? Dun dun! It's when I took my gene therapy. Gene therapies, both telomerase inducer and a myostatin inhibitor. And you can really sense in the video, of course, we hope to change the lives of 6 billion people that day. Now, of course, we're still working on the process and we're going to get these therapies right. And my heart goes out to everyone who's participating and spearheading this new technology. But today, I just want you to sit back and enjoy the video and get excited about your genetic future. Thanks.
Today, we're exploring a topic that could redefine what it means to be human: biohacking and gene therapy. What if aging wasn't inevitable? What if science could help us not only live longer, but live better? It might sound like the stuff of sci-fi movies, but it's happening right now. At the forefront of this revolutionary science is Liz Parrish, often called patient zero of gene therapy. In 2015, Liz made history by becoming the first person to test 2 experimental therapies on herself. One aimed to slow or even reverse the aging process at a cellular level. The other focused on increasing muscle mass and potentially treating serious diseases. But what drove her to take such a bold step? For Liz, this isn't just about looking younger or living longer. It's about changing how we age altogether. Aging is the #1 risk factor for diseases like cancer, Alzheimer's, and heart failure. By targeting the root causes of aging, these therapies could open the door to a world where we prevent disease before it even begins. And here's the kicker. This isn't just about helping individuals, it's about transforming healthcare as we know it. The therapies Liz underwent work in fascinating ways. The telomerase inducer focuses on extending the protective caps on your DNA, called telomeres. These telomeres shorten every time a cell divides, which is a key process of aging. By protecting them, scientists believe they can essentially rewind the clock on our cells. The myostatin inhibitor, on the other hand, increases muscle mass, which not only combats frailty and aging, but could also help in treating diseases like atherosclerosis. But this journey isn't just about science, it's about courage. Imagine putting your own body on the line for the sake of humanity's future. That's exactly what Liz did. She embraced the unknown, taking the first steps into a field that could redefine our understanding of health and longevity. In the next clip, Liz herself introduces her decision to undergo these groundbreaking therapies and the inspiration behind her daring leap into the future of medicine. Let's hear what she has to say.
And when my son was diagnosed with diabetes and I started to actually look at the root causes of these disease, it was just that epiphany moment. It really is in the genes. I traveled to several genetic conferences and this was just verified. So we can look at model organisms. We can look at model organisms that don't suffer from the same diseases that humans do, and we can see what the differences are in genes. We can also look at different humans, and certain humans are predisposed to some diseases and some are not, and it is in the genes. So in that code of life, lies essentially not only our benefits, but our associated risks. And by changing those, we can radically change the future. What BioViva has done to actually plan out and start to achieve some of the things that we need to achieve to radically change how we die, so that we don't die of cancer and Alzheimer's and heart disease and the various organ failures, is to actually spearhead advocacy towards patients, spearhead education. We've started a bioinformatics program. We're selling kits so that you can learn about your genes. And we also have a partnership company that works offshore and offers medical tourism so that we can actually mix our researchers with medical doctors doing these technologies and see what the actual outcome is. This way, we can actually speed up progress by decades. Whenever you're looking at new technology, the innovation is generally way above what the public understands. And we're aware of that. So that's one of the reasons that I'm here talking to you today, is so that we can educate the world in a more expedited way about where technology actually sits and how low their expectations are, in order to, invigorate it and get them excited about the future. What would we want to be the end result of all of the work that we're putting in? We would like to be one of the first companies that gets access to how well regenerative gene therapies perform in humans, therefore expediting their use to the public. And that's the big dream. So we don't think it will be one gene that will cure biological aging. We think it'll be a multitude of genes. So on research and development, we're working with Rutgers to form a large capsid that can deliver multiple genes. On BioViva side, we're working on the bioinformatics program with researchers that will work with the third leg of the company, which is the medical tourism, and actually see how well drugs perform in patients so that investors can invest in drugs that will work rather than the 94% failure rate through the FDA today.
Liz's journey is truly groundbreaking, and her youthful transformation is nothing short of remarkable. She looks visibly younger, a testament to the potential of these therapies. But beyond the visual changes, there's so much more happening beneath the surface. Now, let's delve into the specifics of these gene therapies and their current applications. While the ultimate goal is to combat aging and enhance overall health, these treatments are already being used to address specific medical conditions. For instance, the myostatin inhibitor targets muscle wasting diseases by blocking a protein that limits muscle growth. This approach has shown promise in significantly increasing muscle mass and strength in affected individuals. At the same time, the telomerase inducer works at the cellular level, extending the protective caps on our DNA called telomeres. These telomeres shorten as we age, which contributes to the natural decline in our bodies. By preserving or even extending them, scientists believe we could slow or reverse aging at the cellular level. However, we're still at the beginning of this incredible scientific frontier. The top priorities now are safety and precision, ensuring that these treatments don't cause unintended effects. Accessibility is another challenge. These therapies are currently expensive, starting at around $75,000 or more, making them out of reach for most people. But there's hope. Just like how computers became affordable and widely available, gene therapy costs are expected to drop as the technology advances. In the upcoming clip, Liz provides a deeper look at the science behind these therapies, their life-changing potential, and the hurdles scientists face in making them safer, more accessible, and available to everyone. Let's take a closer look.
Medical tourism is for compassionate care and consensual use, and a doctor has to sign off on your care, and it comes with a high bar of approval. As far as getting involved in genetic testing and participating in our bioinformatics, which is a multi-omic system that wants to solve the problem of the multi-ome. So for instance, if you're just looking at your genome, and you want to know your risk for type 2 diabetes, it might, no matter how it's weighted, it might just be 47% of your actual risk. But if we also look at your microbiome, we look at your physiome, we start to look at your proteome, your metabolome, and what you're eating, what's actually happening right in your environment, then we can have a better risk assessment and therefore help you in more ways. And then if you're interested in actually pursuing treatment, we have that option.
It's incredible to hear Liz explain the potential of these therapies firsthand. Her work represents the cutting edge of what's possible in medicine today, but it's also a reminder of how far we still have to go. The idea of using gene therapy to combat aging is no longer a dream. It's a reality in progress. Imagine a future where diseases like Alzheimer's, cancer, or heart failure no longer define how we age, where we can live longer, healthier lives, not just for ourselves, but for future generations. That's the vision Liz and BioViva are working towards. But as Liz mentioned, making these therapies accessible and affordable for everyone will take time, innovation, and collaboration. The journey is just beginning, but the possibilities are limitless. If you found this video thought-provoking, don't forget to like, share, and subscribe for more stories at the intersection of science and humanity. Let's continue exploring how we can build a better, healthier future together.